Hello, everyone, and welcome to my podcast, Don't Get a Therapist Yet. And today I have a very special guest with me. His name is Alejandro Arguelles. And Alejandro, very warm welcome. It's so lovely to have you as my guest today.
Wendy, thank you so much for having me, and thank you so much for everyone listening in today. I'm really looking forward to our conversation and to hearing your thoughts into everything that we have to say today, which is, I think, very important for many people.
Absolutely, I couldn't agree more. And could you just tell the audience a little bit more about yourself, your role, your interests, your professional development?
Yeah, absolutely. Thanks, Wendy. So I guess that it's quite varied and quite developed, but as you may have picked up from my name, I'm originally from Spain, from Madrid. But when I was 11 years old, my parents sent me to England to study for 1 year only. And I loved it so much that I asked them, could I stay for one more year? And after the second year, I asked, could I stay for one more year? And that led me to stay in England for 13 years and now living in London after having studied, volunteered, worked, and do many things all across England, including in the south of England, in Winchester, in the Midlands, in Gloucester, and Loughborough, and now in London. So my education was based in Loughborough for my undergraduate, where I did sports and exercise psychology. And I found my studies extremely interesting, but I particularly found the clinical aspect very interesting through my studies. Being a BPS accredited degree, we had to ensure that we did some wider psychological concepts as well, not just related to sport. And that led me to a more clinical route, going in to complete a clinical mental health sciences at UCL, University College London, where I found the clinical and research element of mental health absolutely fascinating. And through there, I also started working part time through the company that I work for at the moment, full time. So at the end of my master's, I had a conversation with myself saying, do I go through a PhD or do I go to full time work? And fortunately, I was able to do both. So currently, I work as director of coach development at Gates and Bread to Blue, where we help people all over the world to think clearly, feel in control, and act effectively using Red to Blue as a framework for embracing pressure. But also, I'm completing my PhD in mental health at Lancaster University, which is being absolutely fantastic. And my research interest at the moment, and I know I'm just starting and I'm always learning and I'm always developing, but for the time being, my focus is on really looking and digging deeper into how and why and in what context do interventions such as pharmacological, like medications, or psychological interventions like therapy work for anxiety. And I'm interested in realist methods that try to look at things a little bit deeper into what we see in the surface. And even though I'm doing those two main things, I understand and I know that there's always room for development and always room for improvement. So through that, I've also done coaching qualifications. I'm currently completing a health coaching qualification, and I am an EMCC accredited coach as well. I'm a specialist mental health mentor, helping students all over the country deal with their mental health experiences to help them through their studies. I'm a mental health first aider as well, having completed it through the Royal Society of Public Health. And I'm also a volunteer for Shout, helping people in times of crisis when they need it most. And I have plenty of interests apart from that as well. I love sport, exercising, football, theatre and performance and the arts, traveling. I've been volunteering in Zambia. I've done a lot of education for different individuals. So I guess that all these experiences have brought me to where I am today, which is an increased interest and increased responsibility to talk about the impact of mindset and mentality for people, generally speaking, in two concepts from a performance perspective, but also importantly from a clinical mental health perspective.
Mm. Thank you so much for that. And for those people on the podcast, you're actually still quite a young man, but it sounds as though you've packed an awful lot in your life already. So that's very impressive. And thank you so much for telling us so much about your passion and your interests. And very much mental health is very much at the core of your interests, aren't they, Alejandro? So I think the topic we're going to talk about today is about men's mental health. isn't it? I think you've got a particular interest in that area. And can you just tell me a little bit more, just generally, about why, what kind of mental health issues do men particular suffer from?
Wow, where do we start? So that is a very broad conversation that can link to many elements and many areas. And I think it's important as well as we go through some months now. Just yesterday, it was Mental Health Day as well. And I saw a lot of conversations around speaking up and a lot of conversations around sharing and help and support, which show, again, a change and an increased relevance and importance of these topics in the world of today, particularly for younger generations, which is extremely important. But I'd like to focus specifically today as well around anxiety, one of the most common and debilitating experiences that people can have. And I think for men is quite an interesting area and conversation. Just before we go in there, I think it's important for people to understand as well where I'm um, going to perceive this from and where I'm going to access this information from, because this information is based on my current understanding and knowledge in the area. I am a male, 24-year-old male, and have experience of panic disorder, anxiety, medications, therapy. So this reflexivity and this context is important as you receive this information to understand who I am and where I'm from and how I'm going to go and perceive this. It doesn't mean that there's no other areas that are important, but this is important as we go to speak about men and anxiety for this first part of our conversation. So I guess that where do we start? And I think one of the key interests can be with some of the gender differences in anxiety presentation. So how men and women may experience anxiety in slightly different ways, because there are some widely held assumptions about the prevalence, so how much there is, and also the expression, how people may experience anxiety. And there are, some studies, some evidence that suggests that men experience anxiety less often than women, but may express it in different ways. So, for instance, men may show anger or irritability or engage in some risky behaviors rather than openly discussing their worries. And some common coping mechanisms that have been reported could be things such as substance abuse or overworking, which could often mask anxiety, leading to an underdiagnosis, which is quite interesting because when we're looking at that, then we're looking at why could there be an underdiagnosis for men? Why is it that even though we know and there is massive reports of anxiety around the world, there is these differences that we can see? And it could be maybe of how we're measuring anxiety in the first place. So there was this study done by Smith, which is quite interesting, that highlights that men's anxiety is often underreported for various reasons. It could be that the diagnostic tools that we're using to measure anxiety when we're going to see a doctor or a therapist, they're very suited by potentially how women experience anxiety, such as emotional distress. And again, I'm not talking everyone here. This is just a conversation of the experiences of some people. And often, because of these presentations of anxiety, it may be that they're not being taken in those conversations and in those values. It could be overlooked because of societal expectations of toughness. Doctors may miss these conversations if they focus on more obvious behaviors like anger or substance abuse, which could be more not potentially the root cause, but just symptoms of the underlying anxiety. And of course, men can also feel anxiety inside. And of course, it's not always externalized, but they're often hide it because there's expectations to be strong. There's expectations to not show it, to not portray it, which could make men seem less anxious. So there's many reasons for this differences in reporting, but it could be because of the tools that we're using, that they're not necessarily as relevant for men. Maybe how the external behaviors were going into saying, okay, this individual is showing substance abuse, but that could be again a symptom, not a cause. And we may not be really trying to look at how men experience anxiety in the same way that we do. And that leads to some underreporting, which is interesting.
It's a really good point, actually. And I think even accessing help can be a big thing for men as well. And just a point, I know working in the mental health services, if somebody presents with substance abuse, they'll often be turned away because they would say, you need to get your substance abuse sorted before you can actually access mental health services. So that in itself might turn away, men in particular, who've got this problem. But like you say, it's been masked by other problems or other symptoms. And you're right about the overworking as well. I mean, I can see that happening, and then it might not be picked up by a GP that actually the underlying cause is anxiety. But what do you think about that?
Well, it's really interesting because then we're going into a conversation about the different potential coping mechanisms that men may have to deal with the anxiety that may be feeling. I guess that the first thing is about the recognition that if someone is actually anxious or that they're overworking or that they may be going through substance use or substance abuse, because there may be times that may be due to their friendships or due to their people that they're with or social media that overworking or substance use are seen as things that are glorified for men, working hard, making sure that you're going out, making sure you're extremely successful, making sure that you make lots of money, XYZ. What these things could also show are again are masking the internal anxiety that could be occurring. So that is why going deeper and going into the mechanisms and the roots of that behavior is really important because absolutely, if you are working hard, wanting to gain financial stability and wanting to gain status for some men, that's really important, whatever that is, as long as it's coming from a healthy place, that could be helpful because it's something that you're achieving and want to do that. Fantastic. The question is, are those behaviors being done due to something else, due to hiding something that is actually causing and fueling these behaviors to increase? So having that conversation is really important and asking yourself, where is this coming from? Is this coming from a helpful, healthy place or from an unhelpful, unhealthy place? And that simple question could just really try to direct you into a sense of if what you're doing is something helpful for your mental health.
Mm. I think also, I don't know what you think about this, is that, whether men feel it's okay to express feelings such as perhaps anger and even irritability, and whether actually anxiety is sort of seen as a sort of like a weaker emotion. It's not quite sort of manly to express or admit that you're anxious. And even that in itself might be a bit of masking. What do you think about that?
Again, extremely interesting topic, and we can even put that widely into more cultural perspectives, into how people experience this not only in Western societies but also culturally, because there are some masculine norms that, again, these are wide-held assumptions, and this is all they are. They are norms. They're not how things should be specifically, but these societal pressures that may discourage men from seeking help from anxiety, and this is true especially in the workplace, for instance, or in community settings. And there has been some reviews that have found this element of mental health shame. And this is what I'm speaking about now of maybe not going for help or seeking help or having those conversations because of feelings of weakness. And this is true in a lot of countries, including Western, Asian, Arabic, and African countries increasingly. So I guess the question leading to that is what is it that we can do to help men and individuals seek help and seek this support that is needed when it comes to anxiety, when it comes to these experiences that men may be going through that can be extremely debilitating. I guess that one of the things that I found really interesting as I was doing some more reading and understanding of this is around making interventions that are tailored to positive masculine traits. So if we had interventions or groups that are, for example, men-only support groups, could potentially reduce stigma and encourage help seeking without challenging a man's sense of identity. So it could be, it's not the actual treatment that is made or society. It's about are we ensuring that the treatments for men are specific for the experiences of men? Do they enhance the masculine traits that some of the men are seeking for? And if they're done in a positive light that is supportive and good encouragement to access the support they need while maintaining their sense of identity. Because a lot of the time, when people are going through mental health experiences, they may feel that that anxiety or that depression or that diagnosis, it could be diagnosed or not, is their identity. And this is exactly not the case. What's really important when we're talking about mental health is that this is a person that is experiencing anxiety or a person that is experiencing depression. It's not a depressed individual or an anxious individual, because then that adjective, you're making it part of their personality and you're making it part of their schemas, of their way of seeing the world. And that can be quite unhelpful. Using person-centered language when describing these experiences, when we're going through seeking treatment and seeking support, can also help with this decisions of men, young people, adolescents going towards seeking the support they need without feeling that they are being judged or stigmatized. It's a person that's having experiences, and as humans, we all may experience this at some points in time. It's only normal. Just sometimes we may need some more support to go through these situations.
A very good point. And language is so important, like you say, and not to use that sort of judging, negative, shaming language, which is important for everyone. But like you say, it might be a particular aspect regarding males and their identity. And as an accredited CBT therapist, I find in my experience, CBT works quite well with men. But there are other kind of practices which I don't know whether men initially kind of like embrace them, and the two ones are sort of meditation and mindfulness and yoga. And I think sometimes they're see, and I also do compassion focused therapy as well. I think sometimes the words or how you explain them can actually sound not very masculine. What do you think about that, Alejandro?
I think that's the important thing when you're considering any type of treatment or any type of approach for yourself is what works best for you in what the context and the circumstances that you are in that moment in time. And I think that, as you say, some of these treatments or some of these modalities, it could be, first of all, one of the reasons that they could be seen as such is because they are not probably as spoken or as known about as CBT. CBT is quite a known and one of the most evidence-based research therapies that are around. And of course, even if you haven't gone through it, you may have heard of therapy, cognitive behavioral therapy before, talking therapy at some point in life. But as you know, there are so many different areas that you could go and reach support from third wave therapies, as you mentioned, compassion focused therapy or acceptance and commitment therapy, to things such as charities, yoga, meditation, and mindfulness. So I guess that it goes back to what we said earlier about making those different therapies and those different supports and those different ways of help in a masculine trace and in masculine ways, so people can try and reach that without feeling those circumstances. This is similar to when in gyms you also have woman only gyms or woman only classes, which are fantastic. And they're there to support women who may feel a little bit uncomfortable going through exercises to the gym, to be in a woman only environment, to go through gym classes. And that is fantastic. And I really support that. Similarly, when it comes to mental health, it could be that it could be helpful for men to have those men experiences that are helping each other to get better into that level and understanding that support is available and that peer support with others that are going through similar experiences. And if that is through yoga, if that is through mindfulness, if that is through CBT, or if that is through another experience and another help of support, that should be encouraged and that should be great. The key thing here is that there's a lot of support available, and what works best for you would be what will have the biggest impact, most likely.
I just want to add is that I've worked with plenty of men who do embrace those practices and are very open to those practices and have really benefited from them. But I just, want to sort of accept your point that, if you're not careful how you introduce them, it can, what I don't want ever to do is to make a man feel less masculine, from some of those interventions. So sometimes it is the delivery of that. And it's great. You mentioned so many different therapies there. And what's your research, if it's okay to ask you this, is on what actually really helps anxiety for men? Could you tell us a little bit more about that? What does the research say?
Look, absolutely. So there are a lot of avenues about what helps, and I guess that what I'm going to propose here is not necessarily, the gold standard is the only thing that works, because providing a prescription here would not be, suitable. But I think that an important thing to provide in this conversation is what are all the options that are there available to you as a man who may be experiencing anxiety or mental health experiences. And I think that giving a broad description into what is available, it will be really useful. And all these things I'm going to be talking about have been shown to some degree to be helpful for men experiencing anxiety. And I know that as well from my own experiences. So I started experiencing panic attacks, nocturnal panic attacks, and depersonalization around 4 years ago. And initially, I didn't really focus on it, but it was when it was started impacting my day-to-day life with trips to A&E or with conversations with the family that were becoming unhelpful, or staying at home because I was scared of, getting this panic in public. I sought help, and I sought all these different avenues and all these different approaches, and all of them bring some sort of angle or some sort of layer that can become really useful for a person-centered holistic approach. So if you're happy, Wendy, I'll describe all of these different avenues that men can receive help. And also at the bottom of the wherever you're seeing this in Spotify, there's also a resource list that we've put together in order for you to reach some of these things if you need to. So one of the areas that can become really useful when experiencing this sort of discomfort when it comes to anxiety can be the talking therapies or the IAPS services. So the IAPS services that again these are offered by the NHS, and these are offered by they could be by your GP or by speaking to someone through 111. They were introduced in around 2008. There was a report called the Layard Report by the London School of Economics that basically shared that there was a massive cost of the burden on mental health in the population, and that we should provide access to psychological therapies openly to the public to ensure that they could get access to that support. And this is exactly what has been done since then. And talking to a professional at least helped me to understand some of my thought patterns, some of my processes that I was going through in those moments in time. So they provide evidence-based therapies, as we mentioned, like CBT. In clearing that mental clutter, I was able to lay the cards down on the table that were extremely useful, and it gave me some of the tools to manage anxiety in a structured way. Which, by the way, if there's not only an option to do it one-to-one, you can do it in a group as well. Or they also have a software called, I believe, is Silver Line or Silver Cloud. I can't remember from the top of my head, but it's an online CBT process you can go through as well. So there's different lots of support that you can do through your talking service, and there's a resource at the bottom that you can do that. The other area that can be useful, and I know we're going to touch upon this much more afterwards, Wendy, is through your GP or medical support through medication. And for me in particular, medication helped me during my worst times, especially when I felt completely out of control or completely exhausted by the experiences that I was going through. And it did provide some relief as I was going through the A&E visits, and it allowed me to control some of these elements in the short term through some medications called some benzodiazepines, but also through some SSRIs, so selective serotonin reuptake inhibitors, or commonly known as antidepressants. So we'll talk a little bit more about medication and its use, and if you should, go through medication or not, because it's quite an interesting topic, but that is another avenue that could be done. We talk around charities, and now there's so much third sector support that you can receive help as a man or anyone that is listening to this. These can provide immediate support and extremely useful resources. So some that I can think of straight away are Anxiety UK, which is a charity that provides support for anxiety for any individual, and they provide resources. They provide PDFs with information. They even provide therapy that is useful for individuals that can go through that. Charities such as the Samaritans or Shout as well for crisis support. are really useful if you're going through a time that you feel you really need that support there straight away. They can have good conversations. I guess that when we go into some more, community support or what can I do through others is through peer support. Speaking with others who experience similar struggles for me was extremely powerful. And I know that it may seem difficult as a young man or as a man to speak to other individuals around your struggles, but actually became extremely empowering to know that it was something that just made me human and just made me a person that is experiencing these elements, and it didn't have to define me. That other people, other men in particular, were going through similar experiences. It helped me feel less alone, and it provided context for my own experiences. So speaking through others, either through, for example, Mind, I know provide social support groups that you can go through that are extremely important. And I know that this will be the next point I'm going to make is sometimes easier for some people than others. And I wouldn't expect anyone to go through this straight away because they may have those social support in place or not. But for me, opening up to my family and my partner was also a big step forward. That support helped me feel secure in the moments that I was feeling like I was less ashamed of my anxiety, that I had nothing to hide, that it was just part of who I am and part of who I am as a person as I go through these experiences. And and importantly, that it also provided me that reassurance that it was not just me, that I had also social support that could help me through those moments in time. And if it's not from direct family, it can be from friends, or it can be from people at work, or just anyone that you can speak to around those experiences. Some techniques that I found really useful for myself when it comes particularly through panic attacks, when they are becoming extremely uncomfortable, when, and people may relate to this, when your heart rate is going at, 130 beats per minute, when you're starting sweating, when you're starting catastrophizing about what's next. Breathing techniques have been extremely helpful for me to become more mindful and present into the experiences that I'm going through. So focusing on physical cues really helped me manage in those moments. And for me in particular, techniques like belly breathing or the 4-2-6 technique. So breathing 4 times in, keeping it for 2 and then 6 times out, because that is the one thing that you can control during a panic attack. You can control your breathing. Is something that became really useful for me as I was going through that. One that has become really useful as well for a lot of people, and this is through research, but also through just anecdotal evidence, is exercise. So movement. The times that I have felt most in panic and in most stress and anxious is when I stopped doing my exercise routines. I've always been extremely sporty, and the times that I stopped is actually when it increased the most. And I use exercise to kind of release the anxiety and to release that moment through weight training or through running. And I actually have a reminder on my phone. And I have a little equation that always I refer to before I go to the gym or when I'm feeling that, or maybe I shouldn't go. And it's health plus movement equals better work and studies. Because I know that if I'm feeling healthy and if I'm moving, my work will be better and my studies will be better. So that little equation just reminds me, and it's something that I can see every day, of the reasons that I'm doing this. Now, and its benefits on its own merits should be, exercise cannot be considered a panacea, so to speak. It's important that you go through due diligence, through all the support available, but it is really important to go through here. And of course, as I mentioned earlier, in cases of emergency, you have Shouts, the Samaritans of mental health lines. So hopefully that gives a little whistle-stop tour into all the different areas and all the different elements that all have been shown to help for mental health experiences for men and for the experiences that you could be having in these moments in time.
And a very great summary of all the key areas. And I'm so glad you added the exercise at the end because absolutely, sometimes it's the build up of the adrenaline in panic attacks and actually just sort of moving as well and actually just letting go. Some of that adrenaline is really, really good. And also, just to add one more, of course, the reason I set the podcast up in the first place is the psychoeducation needed in mental health. So, Thank you so much for sharing all that. And I think hopefully people who haven't, who for some reason can't or don't feel ready to access a therapist or those services can listen to this podcast and think, oh, okay, yes, I can do something about my anxiety as a man. And this is where I can start. Because a lot of those things are, you're just using the breathing technique, just knowing that and knowing that you can overcome panic attacks using that is incredibly powerful statement you've just done then. So thank you so much for explaining that in such a clear step-by-step way. Thank you for that.
Thanks, Wendy. No problem at all. I think it's important to realize as well, because I know that some people that maybe are reading and understand about mental health, maybe from social media or from the newspapers. There's so much information out there that it's extremely overwhelming. Where do I start? Where do I go? Well, because I'm sure that they know there's help, but it is sometimes overwhelming to know what the next step is. Everything that I provided there, it doesn't mean that one is better than the other. The question is, what's best for you and your anxiety? What is best for you? You have to be the captain of your own journey when it comes to your recovery and when it comes to the decisions that you're making about your health and your mental health. And we will touch upon that as we go through the medication conversation at the end. But I just want to touch on one more thing that is a very practical way of dealing with anxiety, because for me, one of the biggest game changers when it has come to controlling my anxiety and understanding where I am in some moment in time is the simple concept of controlling your attention.
Mhm.
Where is my attention right now? So I always ask myself, is my attention on somewhere helpful or somewhere unhelpful? So that simple question, before you're going into a meeting, before you're going into a conversation, before you're going into whatever it is that you do, before you're going to sleep, just asking yourself that question, because that helps you shift your focus from unhelpful thoughts to more productive ones. And for me, this skill of trying to improve this element of attentional control and to improve this element, or where are my thoughts right now? Where are my emotions, my feelings, and having this really self-awareness and recognition of my own mentality has really helped me to take power and control of my situation. Now, it doesn't mean that I don't go through panic attacks. Of course, I do. I still do to this moment in time with all the support and help. But rather than not living with them, what I've learned is how to live with it side by side, how to ensure that I can recover through these moments and being something that I can take value in those experiences. And the value that those experiences give me is that when I am having a panic attack, when I'm thinking of something unhelpful, for me, that's a trigger that maybe I'm doing too much, or maybe I need to take a rest the next day, or maybe I need to actually, go out and go for a walk. So a lot of the time, these experiences, I'm using them now as triggers to give me useful information from an attentional perspective into maybe my body's reacting this way, it's telling me something. Maybe my body's reacting this way because it needs something, because the body is very, very clever. The brain is very clever. Our bodies are done and made is an extremely incredible feat. So when you're looking at those experiences, you can also start looking at them as triggers that will going to give you helpful information into what's the next steps for your recovery, for the next day, or for the next minute into whatever experience you're going through.
Yeah, absolutely. And very well explained, because in the moment with panic, it is that catastrophizing is the key thing, catastrophizing about your physical sensations. And just that very, very good tip that people can take away today and actually think more about 2 points. Where is your attention? And also whether there is a message there, which is very different from catastrophizing. It's sort of saying, okay, my body's telling me something, and I need to listen to my body and think, okay, what's the best way to react? So yeah, those very, very good, key pieces of information awareness there that hopefully people can take away and start to put that into practice. So thank you so much for that. Now, I just want to move on to another topic now, because I think you're a bit of a specialist in this as well, and that's performance anxiety for men. So could you tell us a little bit more about that as a topic, please? Thank you.
Yeah, of course, Wendy. It's really interesting. When it comes to performance anxiety, I guess that the first question when we're talking around performance anxiety is, what does performance mean? Because for different people, it may mean slightly different things. Does it mean high performance in competitive environments? Does it mean managing daily life challenges and just getting through the day? And both aspects are important. And both aspects in that spectrum and that continuum of performance is really important to realize that, men, women, anyway, and everyone that are experiencing anything, everyone wants to get better at something. Everyone wants to perform at something. Everyone wants to get a little bit better. No one generally starts at zero. No one's at 100. The goal is always to get better. But as we try and get better, go to the next stage or perform, or again, from high performance to daily living and daily challenges, which is also high performance, what this can create is pressure and anxiety. Pressure from the expectations that we put on ourselves or from others, from the scrutiny that we may feel, and also necessarily from the consequences that could happen if I don't perform, or if I don't do this, or this has happened in the past, this has happened in the future. That happens with anxiety when we're thinking about the future and the past. Not all pressure is negative, but it can sometimes serve as a catalyst for growth. But for men, pressure to perform can have very significant consequences. And when I was doing a little bit of reading about this, there were several areas that really stood out to me into some of the ways that men may struggle from a performance perspective, or that they may feel anxiety. And again, this is not every single person. This is just trends that you're seeing from the research and from conversations that you have. But I thought we would go through some together, Wendy, that have been quite interesting, and that hopefully some of the listeners will relate to as we go through that. One of them is, of course, and many will relate to this, is workplace performance anxiety. So performance anxiety for men often arises from a combination in the workplace from various factors, so societal, personal, and environmental. So the norms that society has placed in the working man, the personal expectations, again linked to the masculine traits that we were talking about in the at the start of our conversation today, but also environmental factors. And how is the business or the workplace creating the environment for those individuals to perform? There was actually a very interesting study I came across as I was reading more about this, about some norms that happen in the workplace. And this is in your reference list if you want to refer to it, that may increase the anxiety of men in the workplace. And I'd like to go through them because I found them quite fascinating. One of them are injunctive norms. So these are internalized rules that men may have in the workplace, such as expectations to be strong, expectations to always go through that promotion, never showing emotions, pushing yourself through challenges. If I crumble during challenges, this may feel like I am weak, that I'm not worthy of this role, of these positions. And then these norms, which are fed by societal expectations of men, often prevent men from showing vulnerability at work. You can't show vulnerability. You can't say that you're struggling. You can't say this because these norms are created from the external or internal, are creating an environment where pushing through challenges is seen as something helpful rather than asking to go back. This is a little bit like in sport. If you look at how usually people are through injuries. So imagine there's someone that has got injured on the pitch. Usually people celebrate when that individual that's injured continues playing and fights for the team and everything. But maybe that individual who's injured should not be still playing. They need to take care of themselves because not the injury is going to get worse because they're going through something that is very hurtful. This could be in concussions. This could be in muscle tears or whatever it is. So that's just a little comparison there that could emphasize the point a little bit more. One of the other norms are descriptive norms. So this is men observe and mimic behaviors from others. They will look at people and copy their behaviors. So if we are building an environment with these norms at the start are their normality, and no one is showing vulnerability because we want to be strong and going through the next stage, then you're just going to do the same thing. If you see others working long hours, struggling through mental health, celebrating exhaustion, celebrating this element of I can't do anymore, I'm extremely busy, it's too much, you may feel pressure to do the same because that is celebrated. And then these are the cohesive norms. So these are learned from leaders, particularly male-dominated workplaces and areas where toughness, emotional control, and long hours can be emphasized, which again creates an environment where men may feel that they cannot prioritize their mental health because it's all about their work and their targets and their KPIs, and nothing else. And that can become quite problematic.
Do you know what? That rings so true. It really does. And I can just see that happening again and again. And that actually just a comment for females. I think sometimes females to get on in the organization sometimes feel they have to show those masculine traits to get on. And sometimes, they feel they have to become very hard and, working, mirroring all the behaviors you said as well. So it's really interesting. I can see that happening again and again. And that idea of copying um, other people. So it becomes like a common culture and how bad that is for us and our environment as well, especially, got to work really, really hard. You've got to be tough and not show any emotions or not show any weakness. How exhausting that is to do that every day.
Yeah, absolutely. And then it has and then the thing with that is that it has a knock-on effect, not only on your work performance, but on your relationships with family and friends, with yourself and your own self view and self-efficacy. It may have a knock-on effect on maybe if you have family as well and your relationships with your kids, if you have any. So it can have a massive knock-on effect on all these other areas and elements. And by the way, I'm really glad that you also mentioned the female perspective, because of course this podcast is all about the experiences of men and anxiety. But of course it could be another podcast that is completely relevant as well for the females and the role of anxiety there, which is completely relevant and really needed as well, of course. So maybe one day we can talk about that as well. But I guess that then this leads to what is the solution then to this in the workplace? Because what it's important, it comes from two areas really when it comes to the solution. It has to come from, of course, the individual perspective and the expectations that they're setting on themselves and their views. But also, I think that workplaces and the environments where people go to work should take some responsibility. So our workplaces fostering psychologically safe environments where people are happy and safe to express weakness and expressing distress and not seeing that as a sign of weakness, but as a sign of if I am not at my best, I will not perform as well as I can. And this could have repercussions for the business, of course, but also for the financials of the business. So actually, if you have a healthy workforce, then the implications when it comes to to the bottom line could be massive. So the question is, are you building that environment where people can become healthier? And by becoming healthier, I don't mean offering a voucher to do a yoga class or having petting the dog day, which by the way, those are great, and I love a dog. But are you actually doing things that are not tokenistic, but are changing the culture of your organization to ensure that you're fostering that environment? And that is extremely useful. Encouraging open dialogue, having conversations where mindset conversations are not seen as a problem, but they're seen as a skill that can be developed. People at all points, we can all improve our mentality, we can all improve our skills from a mindset perspective, particularly when we're talking around performance. So are you developing frameworks that are helping to treat mindset as a skill that can help manage workplace stress? And these are some more organizational conversations, but also from an individual perspective of what we're talking there and those norms and those elements. I guess the question that you should be asking yourself is, who are you doing this for? Are you doing this for others to show that you can be like them, or are you doing it for yourself and prioritizing your health and your well-being and your performance? Because of course, if you are feeling distraught or if you're feeling this complete sense of overwhelmness, it may impact on your performance. So asking yourself those questions from an individual or organizational perspective have to be really important to try and deal with some of the complex conversations of workplace anxiety.
Absolutely, and just a couple of points I think happen a lot is that the person who's meant to support you is your line manager, but it's your line manager who is also assessing your performance and is often responsible for your bonus. So sometimes I think it's very hard. There's a power dynamic there. It can be very hard for an individual to say to their line manager, I'm struggling and I need support. And I think one thing you mentioned as a possibility is having these mental health first aiders where people feel they can go and have a confidential conversation with somebody about that. Because I think it can be particularly hard to open up with somebody who is measuring you on your performance. What are your thoughts about that?
Well, Wendy, I've done the mental health first aid training qualification by MHFA England, and they're
Yeah.
doing some incredible work in getting more people trained in these instances from a workplace perspective. And I think that is extremely helpful to an extent, and I'll explain why. I think that from a individual perspective and helping those people that are in need of that support to point them to the right resources and help from an individual perspective, that is extremely useful and it's needed. And again, it lies in the continuum of an individual. But when it comes to the culture that the organization is providing, you can have a lot of mental health first aiders. But the problem with that is that they're kind of, if they're seen like on the side, that you
Absolutely.
have to go to them to receive support, then that's creating a problem
Mm.
rather than are you making it just part of your organization, part of your culture? Are you creating a psychologically safe environment? So, yes, you need that support for the people that need that one-to-one support when they need it most. Again, as the name suggests, mental health first aid. This is something that is done when you really are going through those instances, and individuals within the workplace will be able to help. But this is wider than that, because if you're not creating a culture in the workplace that is supporting men and women to really show and it's not vulnerability. I don't want you to show vulnerability. I think the word is self-awareness. Are you showing self-awareness that you're currently in completely maxed out of work or completely burnt out or completely, and that self-awareness, what it should create for that business is, okay, my employees are self-aware of their own capabilities, which is really useful because then I can provide the support to help them move forward. And again, support doesn't mean a voucher. Support means the environment that you're creating to talk about mental health experiences.
Mm. And I think you're absolutely right, and definitely it's a whole cultural change that needs to happen. And I think it's almost like sort of saying, almost organizations saying to themselves, it's actually a strength to admit, to be more aware and psychologically minded, and to sort of admit it's okay to say things like this is overwhelming me, or there is something like that, to see it not as a weakness and a strength, and actually encourage that as an opening conversation to have on a regular basis. Might just make that shift, that one small thing might sort of shift and actually allow people to actually be more open and more expressive about areas where they think they're struggling.
Completely, Wendy. I mean, the question I would ask is, if you're a business or organization, you should be looking at, okay, we're going into this next quarter or into the next element, and you're talking to your employees and saying, of course, it's normal that you're going to feel anxious and pressure. It's normal. We're all going together through higher performance. We're asking for higher targets. We're asking for higher objectives. You are under-resourced. Of course, you're going to feel overwhelmed. I would feel the same. There's going to be anxiety. There's going to be areas of struggle, but we are here to help you, support you through that, rather than give you just, kind of, again, a couple of tokenistic tools so they can take a checklist of the well-being area, So as you're going through your organization, through the team, if you're feeling that you're in an organization that cares about the psychological environment, because if we're talking around performance one day,
Oh yeah.
performance is not just around how skillful you are at something, or the structures that are put in place. The mindset element is extremely important. I'm not saying that you don't need the first two. Of course you do, because if you don't, I can be the best and have the best mindset in the world, but if I don't know what I'm doing, I'm not going to be able to perform that job. But usually the mindset element and the psychological element is the one that is kind of put aside and given less attention, or it's harder to talk to. It's a little bit more mystical. So the conversation here as organizations is, are you providing that safe environment? And I think that is important. And when you're talking from an individual perspective as well, because sometimes I know some of you may be thinking, Alejandro, that's great for you to hear, but I have no control over that because that is above me, that is beyond me. And that is absolutely true. There will be some times and some situations where you cannot change the full culture of organization because that may come from a top-down perspective. But what you can do is that you can start looking at again and the self-awareness of of the elements that you can control in that situation, and focusing on recognizing when you're getting caught up on elements that are unhelpful gives you the first step to then try to move into somewhere more helpful that is going to help you do your job or perform again in a high performance in your day-to-days in a way that's more useful.
Yeah, absolutely. I think you make a very good point that listeners who are listening to this podcast might be thinking, well, that's great, but I can't change my culture. But part of the reason to do the podcast is to give people the skills so that they can understand and move on themselves, and empower themselves to think about what they can do. Because we're not taught, are we, in school? We know a lot about history and geography and everything like that, but we're not always taught about how to understand our mind and how our mind works. Yeah, very good point. And I just
Yeah,
like to,
no.
yeah, absolutely. And I'd just like to move on to our last main topic, which is, I know it's a special interest of yours as well, but it's sort of medication and mental health. And I know that's a very big subject as well. But can you just tell me a little bit more about your research findings on what are the key issues around that?
Well, again, this is something that's very close to me and very close to my experiences and the relationships that I've had with medication. But medication is a very interesting topic, and it's gained, I think, more and more attention as the years have gone by. And to give you an example of it, it was Dr. Alex George, who's now the mental health ambassador to the UK government. He was on Love Island. Um, he did the Post Your Pill campaign not that long ago, which was raising awareness of medication, and you had to post your pill that you take every day, maybe your sertraline or your escitalopram, which are antidepressants, just to normalize the consumption of medication in the public. And what's interesting and what's really clear is that the increase in medication is going into into a direction that is growing per year. So more people are being prescribed this medication by their GPs. But also we're seeing an increase in anxiety, depression, and other common mental health experiences. So we're going to talk around that a little bit in detail. But first of all, for those of you that may not have that much experience with psychiatric medication, which I wouldn't expect everyone to have, and that's okay. And what are these medications used for, and what are they there? So these types of medications, they're used for treating and ameliorating or reducing symptoms of mental health distress, so anxiety, depression, and it includes many types. So you have antidepressants, which are some of the most common ones, but you also have some called benzodiazepines that help as well to relax for anxiety, also used for epilepsy. You have antipsychotics for mood disorders and mood stabilizers as well. So there's a lot of variation in medication. And even though it helps with some of the symptomology, what you have with medication is you have side effects as well. So you could have such as weight gain, drowsiness, loss of sexual interest. There can be plenty of things that could happen, not always, but sometimes this is what's reported. And then what you have based on this balance that you have to make is the challenges between healthcare providers and service users. So there's disagreements between service user or the patient or the individual and the doctor about the trade-off and the benefits of the side effects. So if I take this medication, okay, it's going to help me with this, but is it going to make me feel any better? Am I going to have any choice moving forward? Is it going to be something that I'm going to be dependent on? And then what you have is a massive pressure to take medication. Because sometimes that is what happens. You may go to a GP appointment, you express your distress, and you may just be given a medication. So a prescription for sertraline, 50 milligrams, or escitalopram, or whatever the antidepressant is for that moment in time. But many people want to say more about their treatment, but you face barriers. You only have 10 minutes to have a conversation with a GP. And maybe there's lack of training from GPs as well, from the conversations specifically about those kinds of medication, because I know that they have wide training. But when it comes to the guidelines for anxiety, there are some recommended treatments, and the common medications include SSRIs, which are antidepressants, and sometimes the benzodiazepines for short-term relief. But I mean, as you know, medications are often combined with therapy, and there is just a lot of debate on the effectiveness of this medication. So some studies show benefits, while others, which again I've put in the reference list, which is the Moncrief Umbrella Review, that argue there's no link between serotonin and these conditions. And the whole point of when these medications were created was to help with the serotonin system. So it's a very interesting area.
Yes, absolutely. And I think I don't know what you think about this, but I have many discussions with people that I support regarding medication, and my general view is it's an individual choice and it's based on education. And sometimes some people choose not to have medication at all and won't touch it, and other people choose to use medication but also we have conversations about whether they want to change the level of dose. Some people actually want to go up a little bit if they're having distress, or a lot of people actually, when they start to feel better and they're actually using psychological therapies, feel okay. I feel I'm ready now to start to reduce my medication, and that's done. I recommend that's done with GP support and slowly. Other two recommendations I do as well, because I think your point as well is what can happen is you have side effects when you start to come off the medication, and that can actually make people feel very sort of unsafe or destabilize people. Then they start to panic, what can I cope with this and everything like that. And it's about
Mm.
supporting people through that process. So what's your experience of medication been like?
My experience has been a complete roller coaster when it comes to medication. And there's been times that I've taken it. There's been times that I haven't taken it. There's been times that I thought that it should be something that I take for a long time. There's been times that I haven't. The most important thing and the biggest takeaway from the conversations around medication and anxiety, and this is relevant to both men and women who may be hearing this conversation, is to go through a process of shared decision making with your healthcare provider. It is extremely beneficial for you. And at the moment, in the NHS and in the medical world, there's this shift happening. And over the past few years, it's been extremely important of moving from a doctor patient relationship. And as you mentioned, this power dynamics between that relationship, very paternalistic relationship, to giving a choice and giving an informed decision to the individual that is going through that treatment or medication. And in fact, the NICE guidelines, which for those of you who don't know what this is the National Institute of Care Excellence, and it provides all the guidelines that doctors and healthcare professionals have to look at and adhere to, so to speak. And in the NHS recommendations, support shared decision making. And it's something that you should really be looking at. What does that look like in practice? What it looks like is asking those questions to your provider, having those conversations, being curious and not taking information at face value. Because when you're making those decisions, they have to come from yourself. If you feel that your decisions and your treatment is being guided by someone else, you're going to feel a much less control of your mental health experiences and also of your recovery. So there is no one size fits all. And as you mentioned, Wendy, this education and choice is extremely important. Some people benefit and some not, but being the captain of your own journey, being the captain of your recovery and of your treatment is extremely important. And making sure the decisions you make, the doctor is there to give you the best available evidence and support, and with the information that is the most relevant and clear from the evidence. And then once you have that information and once you have that evidence in front of you, then you can start making a decision about your care. But being the captain of your own journey is what's going to be helpful. And then everyone else, the social support, the peer group, the therapists, they're going to help you steer the boat. But you have to take the boat, because if not, you're going to feel much less in control. And that could actually exacerbate your anxiety. So and the mechanisms behind this are still very debated, but going through a process of shared decisions, and there's lots of things. So there are patient decision aids, for instance, so sheets that you can complete with your healthcare provided. There is something done by Deegan, which is a researcher, called Common Ground, which is a software that you can have conversations and having shared decisions with your provider around medication. I know this happens in the US. I'm not sure in the UK. So this is something that is increasing. This is something that is not only a recommendation, but it's guidance. So please, when you're going into this conversation around medication, be curious, be open, and be the captain of your own journey.
Absolutely. And that sounds like a really, really good answer. And I know that I think one of the problems, like we said before, is the lack of time now with GPs. And you've only got 10 minutes is to have those conversations and not just to sort of like quickly prescribe medication. And another problem at the moment is the IAPT services in some places have a very long waiting list. So to actually access the therapy can be a problem. So some people just, oh well, let's just put you on medication while you're on this waiting list as well. But like you say, it doesn't actually feel like an informed choice. So yeah, very good points. And I think, like you say, just making clear about the things that people do themselves. There used to be a scheme, I don't know whether it's still running now, where GPs used to prescribe exercise or going to a health club or a gym as part, so that they prescribe it, not just medication. And that, I think that just gives a whole new different message, doesn't it? Going back to our previous conversation about exercise, just actually people getting out and moving can actually, it's just one little thing that people can do to actually improve their well-being. So
Yeah, absolutely. And on that as well, which I think is really, really important, Wendy, is because what is the use of medication? Because when you're thinking around medication, because sometimes we can confuse the physical health with mental health. And with physical health, usually you're going to take a medication and it's going to be to completely take away all the symptoms and all the issues that may be happening to you, or it could be to help you, stabilize some areas, and that is very clear in the physical world. When it comes to mental health, again, a very big shift that is happening at the moment. And this is again very important as an individual and as a piece of information as you're going through your mental health treatment and experiences. Is that there's been a big shift going from a model of mental health that is about let's take away the symptoms, so a bit like physical health. So this is a symptom and we're going to completely get rid of it, to a recovery focused approach. So how do we help people feel in peace with their experiences, and how can we help them move and recover as part of their journeys with mental health experiences? So again, when you're having treatment, when it comes to therapy, when it comes to medication, peer support, social support, everything that I mentioned before, also there is a consideration that you may want to ask yourself about. It may not necessarily be completely and utterly getting rid of every symptomology. And by the way, by that I don't mean that you're not going to, feel. It's not about feeling terrible and feeling in distress all the time. That's not the point. But it's about how do we recover and go through these processes in a shared decision, person-centered approach to feel at peace with the experiences you're having. So for me, that has been knowing that when I'm having panic attacks, that is giving me helpful information about, am I stressed? Have I not eaten today? Have I done too much? And that is my way of recovery. My way of recovery is knowing that this is giving me useful information. And I know that I may not never have a panic attack again. I may have them. I've come to terms with that. And I know they're very uncomfortable. But what I know is that it's part of my experience of being a human being that's alive and it's moving and it's working and it's got high ambitions. But at the same time, it's part of the process of recovery. So when you're going through those conversations, be very clear about the expectations that you have with your healthcare provider. Is your expectations to completely, take away all symptomology? Is it to have a recovery focus with your symptoms? Having that conversation is really important, and not conflating the world of physical health with the world of mental health, which is very complex and multi-layered.
Very much so. And just another point I want to make about medication is what I'm also, which is emerging a lot now, and we're not going to talk about this in today's session, but sort of neurodiversity. So sometimes people have anxiety or difficult relating to people because they've got an undiagnosed condition. It could be something else. It could be a form of autism, or it can be ADHD or another one, which has impacted them and has actually caused them anxiety. And if you just sort of mask the symptoms, sometimes it masks that they're actually having a better diagnosis, and actually that's the problem. And if you understand that's your problem, then you can find out a way of dealing with it. So sometimes, yeah, just getting rid of the symptoms might also mask other things that might be going on for that individual that might help to be thought about a little bit more clearly. So that's something else that has come out of conversations about that. So yeah, the idea that you're suggesting about having those sort of open-ended conversations and that shared understanding, I think will really help to really understand what's going on for that individual. Yeah.
Absolutely, Wendy. I think that it's important to, when you're going through your treatment, through your recoveries, to be curious and to be open, because I guess it's important to say that in research and in the field of mental health, we don't have all the answers.
Mm.
We don't have all the answers into what is the perfect solution and the perfect thing for everyone, because it's very complex and it's very multifaceted. And we live in a context that is open and it's ever changing. And we have things such as social media, phones, all the time getting this stimuli happening. So the question when you're going through those processes and those elements is, as I mentioned, to don't take information at face value. Make sure you're making informed decisions in partnership with your healthcare providers in order to give you the best course of treatment for yourself. And that will have the best chances to helping you in your mental health journey.
And that's a lovely summary, I think, of all the things that we've discussed today, and a really good thing just to hold on to that one key area, to be an active participant in actual your understanding your mental health journey, and to work in partnership with your GP and your other people who can support you. So thank you so much for that. And I won't be surprised if people would like to get in touch with you after your very detailed and very interesting comments on mental health and men, especially. So, how can people get in contact with you?
You're more than welcome to contact me on LinkedIn. I'm very active on the platform, and you can do so if you wish through that. And we'll put a link to it on down on the Spotify. Please do connect. I'm always looking forward to interesting conversations and approaches and ideas. So you can do that absolutely. The other thing that we'll add is my email address. Please feel free to send me an email whenever you want to, again, have conversations and to debate and to open my mind and ideas. Because as you say, Wendy, I'm 24. I'm starting, and I am developing my knowledge and my skills and my understanding as I go through the complex world of mental health, not only from a research experience, but also from a personal experience. And anything that I can do to improve and to develop and to open my sources of knowledge, and that is with anyone that wants to get in touch, please feel free to do so, and I'll be more than happy to have those conversations. So those will be the two main areas to connect with me.
And thank you so much for those. And those contact details will be put in the show notes if you want to get in touch. So thank you so much, Alejandro, for a wonderful, wonderful conversation on men's mental health. Very much needed, I think. And you've given such amazing insights today. So thank you so much on behalf of myself and all the listeners who have listened to this podcast today. Thank you so much.
Thanks to you, Wendy. Thank you very much.